Good day, everyone. Live from Cloud City, Seattle. This is This Justin. I'm Justin, and this is the Microsoft Reactor show for what is new in tech. And today's topic, I couldn't be more excited to talk about. I think everybody's got a perspective and a thoughts on healthcare, particularly when one thinks about the last couple years and all of the digital transformation that is occurring. And so I have an excellent guest speaker today to share a little bit more about the healthcare tech and what is new. Welcome, Doug Seven.
Thank you, Justin. It's rare that I get to hear somebody say, I'm excited to talk about healthcare. So that's super fun.
Yeah, totally. I think it's interesting, and it's going to take time. It's going to take incredible technology. It's going to take everyone's efforts to transform healthcare and make it serve our collective humanity's needs just a little bit more. But what a worthwhile endeavor in that process. So as we talk about that a little bit more, just a reminder, everyone, this Microsoft Reactor event, we have a code of conduct. Obviously, be polite. Be respectful, but most importantly, log into your favorite chat platform, whether it be Learn TV or YouTube or Twitch. We're on all three today, and share and ask your questions. We are going to be taking some audience questions and things like that as well. Also, this live stream will be available on demand after, so feel free to take a look at that if you want to pause, play, and rewind as well. So with that, let's get to know you, Doug, just a little bit more. As well. So first of all, Doug, I think I've known you for many years. You were a leader in Microsoft and in IoT and in advocacy, just as I was starting my career in advocacy, coming over from the product team and things like that as well. So all that's to say, you inspire me in many ways. And one of the things I remember the most about you is that you're a passionate technologist. It doesn't really matter what you do, and that you're always just so interested in different things. So what kind of tech are you excited about right now? Is there a project or something that you're involved in?
Boy, I'm drawn to so many things, like technology. To your point, I love technology. I've been around technology my entire life. And so I've been involved in some way, shape, or form. I spent a long time actually really deep into the connected device space, just doing anything I could just to build and play with things. And I took a little bit of a breather from connected devices after using them to build Halloween props and doing all these other things. And so lately it's actually I've been returning to the analog world. Whoops, I got to go this way. The analog world of stringed instruments. So still with technology, I still have all kinds of technology around that I use with them, but it's been a lot of fun.
Yeah, I didn't know that you were a guitarist.
I would say I'm better at buying guitars than I am at playing them. But I'm learning.
Very cool. Yeah, I'm a guitarist as well. Played mostly acoustic guitars. I've got one electric in my collection, an Epiphone SG. But kind of got into music technology for a while. It was something I kind of discovered in college. Obviously, the tech is so much better now, where you can layer together so many tracks and things like that. But that's a fun area to explore. A little music intersection with tech and such.
Well, that was actually probably one of my earliest areas of diving into technology. Was back when I was much younger, didn't have gray hair, and same thing. I got into music through technology, and so I was doing a lot of electronic music with sampling and synthesizers and sequencing, running MIDI chords all over the place, and controlling stuff. So that was sort of one of my early entrants. And we would in the mid 90s, we would build websites to share music when nobody even knew what a website was. So that's where it all started.
Yeah, very cool. Well, you recently, maybe not so recently, but more recently, got involved more in healthcare and tech here at Microsoft.
Yeah.
That's can't be the easiest job on the planet when it comes to technology and stuff, Doug. But yet it's so worthwhile. It really has a chance to transform people's lives, make a real difference, and improve access and improve just the experience for people. And never a more important time in the past 2 years as well. So what inspired you, I think, to move into healthcare tech?
Yeah, I say a little tongue in cheek. I was previously in my previous role, so go back 5-6 years ago, I was working in our Azure IoT group, and I was building our Microsoft connected vehicle platform and our Azure Maps platform. So building, the connected cloud infrastructure and devices for everything from just simply I want to unlock my car from my remote to I want my car to drive itself. It's very regulated industry, very slow to move. Takes a long time to build a car. So if you want to put technology into a car, it's years in the making. And so when we launched our connected vehicle platform and we launched Azure Maps, I said to myself, what could be harder than automotive? Healthcare. That's what could be harder than automotive. So I say that a little tongue in cheek. It's kind of fun. Yeah. But, it was moving from one industry to another industry where highly regulated, lots of fear, uncertainty, and doubt from the audience that was participating there, tending to be a little bit slower to move into technology in many cases. And for me, it was like this was just another interesting problem to solve, and one that we Microsoft have tried to participate in different venues along the way. Different efforts to try to play in healthcare. And I felt like similar to automotive, I felt like this time around we kind of had a better frame of mind of where Microsoft could play to our strengths in healthcare. And then it was really on the platform side. Like in previous endeavors, much like in automotive, in previous endeavors, we tried to be in the solution side of the business. And we're not the experts in healthcare. We're the experts in data and cloud and scale. And so if we can apply that to healthcare and then partner with the experts that know how to handle things like point of care or insurance and pharmaceutical clinical trials, things like that, and play to our strengths while they play to their strengths, then that's great. So it was a really interesting problem to go solve, and one that every human being on the planet has some familiarity with. In some way. You may not necessarily know a lot about the data behind the scenes or the systems behind the scenes, but everybody has healthcare and is involved in some way.
Well, and to some degree, when the technology melts away and the patient and the care team have just a great experience in what the point is, which is to help somebody feel better or prevent things or whatnot, that's success. Is that in the background there's incredible data and cloud and other technologies that are facilitating that experience. And so I think that's Microsoft at its best. We melt away in the background and we let the heroes do what they're going to do best. And so,
if we're doing our job right, nobody knows we're here.
Yeah, totally. No, it makes total sense.
And I have all these like personal, and everybody could probably instantly pull up some experience that they've had in their own healthcare where they're like, oh, this is just so aggravating, or this is really, and I have lots of these experiences where I almost immediately send an email to my team and be like, this is the problem we're trying to solve. This is what we're trying to do. I was at a couple of years ago, my son had appendicitis, had to have an appendectomy, and he was diagnosed at Children's Hospital. But this was at a time the local Children's Hospital here was having a mold spore problem in their HVAC system. So all of their ORs were closed. So they couldn't do, it's a very standard, care plan for appendicitis. It's done every day, but they couldn't do it because of this HVAC problem they had. So they had to move us to another hospital and have another pediatric surgeon do the work. And they're like, hey, we're going to put you in an ambulance. We're going to drive you over there. It's all taken care of. Don't worry about it. And as we're driving away, they hand me a manila envelope that has like printouts of every observation they made while we were there and a CD of the, images that they did when they scanned to see, what the problem was. And like, give this to the doctors when you get there. I'm like, this was the state of the art, right? It's like, hey, I'm going to physically get in an ambulance. I'm going to carry this manila envelope and I'm going to hand it to somebody when I get there. That's the state of the art.
Yeah. What if we had data interoperability in healthcare and that data just arrived at the other location and the doctor had an opportunity and their care staff had an opportunity to review it. So
meanwhile, I can buy any homemade knickknack in the world off Etsy with my phone.
Yeah, totally. Well, we're going to talk about that a little bit more. I understand you and your team have an excellent project that is seeing the light of day and starting to make a difference in customers. But before we get to that, I want to put healthcare in context for all of our Reactor community out there that is watching this. So let's begin with some things that are maybe universally understood or something that we've heard of. Let's talk about personalized medicine, for example. And so, Doug, what is personalized medicine, connected care, some of these new words that are being shared in healthcare circles? What do those mean to you as a tech leader?
Well, I mean, that's a little bit of the holy grail in the sense of what we want to accomplish. And if certainly if you're in the United States, you've probably experienced this scenario that I'm going to describe, and likely in many other parts of the world, especially parts of the world where healthcare is already starting to be digitized. Over the last 20 years, we started digitizing health records and things like that, going from paper files to like now the doctor walks in with a computer. And that's part of the problem. So there's two things that happen is you go in for, anything, you have a standard visit or you have something happening, you go in. The doctors that you see spend very little time with you, and they spend most of that time with you looking at a computer screen while they're entering notes and they're asking you questions and they're entering information. And then while that's happening, they're managing a decision tree in their head that you say, oh, I've got this symptom. They go, okay, and that puts me on one part of this decision tree. And then I've got this other symptom. And they kind of work their way down the decision tree, and then until they say, okay, well, it's probably this. And the standard of care for that, for your diagnosis is XYZ.
Yeah.
And so it's very non-personalized. Like the interaction isn't very personalized because they're busy typing and entering information into a computer. And the care plan is pretty standardized based on navigating this decision tree. And the thing that will happen oftentimes, unless you as a patient are a good advocate for yourself, or the doctor that you're with knows you really well, is they don't have that full context of you as a human being. There's lots of other things that could go into how you should be treated beyond just navigating this decision tree. And so the things that we need to solve for there are, one, disconnecting a doctor from a computer so that they can be more engaged with you as a patient and see you and focus on you and look at you, as opposed to focusing on entering information into an electronic health record system. And that's where things like the products from Nuance come into play, where they can, we have this ambient intelligence capability called DAX, where a patient and a doctor can be in a conversation, and that conversation can be ambiently captured and transcribed and transformed into medical context. But then also not just having the doctor being focused more on you, but also having the information at their disposal to make that decision tree navigation more personalized to you, that instead of it being a standard decision tree they're navigating, it's your decision tree they're navigating, because it starts with the fact that you've got this history, or you've got these conditions, or we know from your DNA that you have some, predisposition to something or something like that. And then it becomes your healthcare, not just healthcare. And so those are all problems we can solve with technology to make it a less technology-ridden experience. You know what I mean? Like we're gonna take the computers out of the equation by making them be a little bit more invisible, and also making that data more readily available.
Yeah, that makes sense. In a sense, you're right. It's like paradoxical. If the technology is doing the best thing possible, there is less focus on technology doing the actual moment of care, which allows care staff, doctors, and everyone to participate more earnestly in the discussion, including the patient. From my own experience, sometimes care staff are scheduled in 15 or 20-minute increments, and so you're given 2 questions, and if you have more than 2 questions, you start to run out of time. So what if it could be 3 or 4 questions? That would make a profound difference in just contextually you understanding your own care and understanding what the options are and things like that, as well. Very cool. Yeah. Well, my other kind of, I'll call it, icebreaker, let's talk about healthcare tech questions is just the rising cost of healthcare. Obviously, everyone has a thought, an opinion on this. Politicians, care staff, certainly patients, insurance companies, or other people that are payers and things like that. How do you believe, how can healthcare tech help address some of the inevitable challenges with cost of healthcare? Yeah,
this is a real serious problem. And it's different in different parts of the world, whether you have in the United States, where it's I'll call it a commercialized healthcare system, where individuals and insurance companies are paying for healthcare, versus in other countries where maybe it's government subsidized or government funded healthcare. So the problems are different in different parts of the world, but certainly a huge problem. And it's interesting because, there's certainly an aspect of what we do in that if we can do things like make data more readily available and make data about patients or about healthcare more usable in different ways, we could, theoretically, we could help drive the cost of healthcare down. But there's actually an incentive or a push from the Centers for Medicare and Medicaid Services, CMS, in the United States. CMS pays for roughly, depending on when you look at the data, about a little over half of the healthcare in the United States. Mm-hmm. And so they are motivated to try to drive the cost of healthcare down. And so they want to do things like make the data about a patient's entire life of care available to every doctor who sees that patient. So think about this. You have something happen and you go to an urgent care and you see a doctor and they say, we're going to have you go do a blood draw because we need to run some tests to see what happens. And they don't know that you just had a blood draw like a month ago that would be totally relevant to this. And so not only do you have to go through the pain and suffering of another blood draw, but it's got to be paid for, and it's an expense, and it's a time delay, and it's all these other things. And so one of the things that CMS is trying to do, they call it data at the point of care, which is let's take a patient's total data, and they look at it, in this case, they look at it from a compensation standpoint. We've paid for all of these services, so let's make sure that any doctor providing you care can see that and go, oh, I see that you had a blood test just a month ago. That's still relevant. Let me go get the results of that blood test and take a look at it rather than sending you off to go do another one. So there's all kinds of different initiatives on how to drive down the cost of healthcare, from just making data more available to also using data to, build up these sort of AI and ML pipelines to start to do, in some cases, predictive stuff, but in a lot of cases, it's just about efficiency. Operational efficiency. Like if you can make a hospital more operationally efficient, you can drive down the cost of healthcare. Or clinical efficiency. If I know more about you and I can see more about you, then I can do the right thing instead of like a lot of experimentation.
Yeah, totally. And one of the things that I've personally experienced in the last 2 years was I had my first telemedicine appointment. And specifically for me, it was a combination. As I used a new benefit to practice mental health online. It was the first experience where, similar to like Microsoft Teams, or video chat, you're chatting with a professional, but it's in the comfort of your own home. You don't have to go anywhere. There's less of an office or less people in and out of the door. But also, I had a moment where I thought myself and my family had COVID, and we were able to take a test and then discuss it with a medical care team directly. We didn't have to go to the building. And so it's an interesting other aspect of healthcare tech about, a combination of driving costs down, but also increasing access for all those busy people out there trying to get into a medical building and such. So what do you think about telemedicine and its promise over the coming years?
Oh, this is like, I guess I hate to put it this way, but if there's a silver lining of what a global pandemic gave us, it was the push to move forward into some of this technology to think about delivering care in a different way, right? Telemedicine had already started to exist, certainly before the COVID pandemic. But that really was the push that moved it to be more commonplace, more mainstream, where almost everybody you talk to now has had some telemedicine experience. One of my neighbors is a doctor, and all she does is telemedicine now. She doesn't see patients physically, and so I think it's one of these things that like is the positive outcome of something that was horrible and terrible that happened. But as a result, it's changed the landscape of healthcare, certainly in the United States and elsewhere, in the sense that now that is a kind of a normal. Like before, it would be really abnormal if you told somebody to talk to a doctor and do it over, a video chat. They'd be like, "Well, that's crazy." Especially like if you think about our parents' generation, you're like, "Hey, you should just have a video call with your doctor." They were like, "Oh, that's crazy." And now that's like, I would. Like, I'm going to do that before I go see a doctor in person. Like, why would I drive to a building and go talk to somebody in person when I can just, be in my pajamas and get on a video call? And the technology is getting really good. Like aside from just things like video technology, where we have things like high definition video now, and you can do things like a COVID test, remotely and have somebody observing you performing the test at home so that they can certify that it was a valid test. But also you can imagine things like dermatology, which is very visual, right? Like dermatology is very visual and very photograph driven, where they look at your skin, they take pictures of your skin, they do stuff.
Yeah.
And now that's able to come through video. But even more so, the technology is getting further and further advanced. And now, I mean, you know what your experience is. Now imagine the practitioner's experience. They're talking to you on the screen, and very likely right next to them on the screen is your entire medical history, right?
Yeah.
In your records. And now they're talking to you and looking at you and engaged with you and having this information readily available to them. So now we've kind of flipped a little bit there. They're looking at the computer like they were when you were in the room, but now you're on the computer. And so it's a little bit more, it's ironically more engaging to do.
Yeah. And there's some interesting, I think, dimensions one can take from this. I kind of liken it to the freeway that I used to commute on, where I used to be one of the people in traffic. But one of the things that I think telemedicine can do is for people who just need a direct conversation with a doctor or care team that doesn't require a person to be physically in person, that actually in some cases creates space for those people who truly need to be in front of doctors at the right time. Maybe it's a potentially more serious condition, or it's something that requires even more contextual information that really only an in-person interaction can facilitate. And so in my opinion, it's not just about you and your medicine, it's about the collective we and how we utilize the healthcare system.
Well, there's another interesting like positive outcome here, which is, before we had done this project years ago with the Fred Hutch Institute, dealing with oncology patients and really trying to lower the rate of readmission. So an oncology patient is getting treated, they get checked out to go home, and then at some point they get readmitted to the hospital because they get sick and something happens. And oftentimes, not always, but oftentimes, they'll have a sickness related to their medication, their care plan. It will cause some sort of side effect and make them sick. And then they come into the emergency room. And so you have an immunocompromised person who's on oncology treatment walking into an emergency room that's full of sick people.
Yeah.
Right.
Yeah.
And so one of the, and then they get sick and they get readmitted to the hospital. It's terrible. And so one of the benefits of telemedicine is like, what's the worst thing you can do when you're sick is go be in a room full of a whole bunch of other people. But that's exactly what you do. You get up and you go into an urgent care or an emergency department or a doctor waiting room full of all kinds of other people while you're sick.
Yeah.
Now you can stay home and have that treatment conversation and that care plan conversation without taking it out into the world.
Yeah, totally. And I see a couple comments in our chat window as well. Data privacy, data security, how these things come together, how data is shared across that. Obviously, these are very important things as we move towards more tele and remote based things as well. And so, Doug, how do you think about balancing between the opportunity and promise of telemedicine with the needs for customer privacy, data privacy, and things like that as well?
Yeah, I actually say I'm not sure I balance that at all. I first and foremost think about the privacy, security, and safety of the data.
Yeah.
Like that is, I will often use the phrase on our team that compliance from file new, meaning like unlike every other Azure service. So our team builds Azure data products, right? Every Azure product that comes out and gets to general availability, and then it goes through a compliance process to meet different compliance and certification requirements so that it can be used in different industries. So when we released Azure Maps, we put it out there, and then after it got out, we went and got ISO certification, and we went and got whatever other certifications we needed so that our product can be used in different scenarios.
Yeah.
But the Azure Health Data Services is only for protected health information. And so we have to meet all of those compliance requirements from the very beginning. And so we talk about as compliance from file new and as a, compliance and privacy as a feature, in that's a big part of what we provide. Is not only do we have a data system in the cloud to bring your data into and then make that data available and usable in different ways, but that data system is itself a healthcare compliance boundary.
Yeah.
And so for me, that's like job number one is the privacy, security, and safety of that data. And then within that context, making that data usable in different ways.
Yeah.
That's like, there's just no other way to do it.
Yeah. And to some degree, as we were talking about, if we Microsoft, we do that right, and we build a product that is compliance first and privacy first, and that I like your term file new. That's super cool.
My visual studio is coming back to me.
Yeah, but then again, that allows the technology to melt away and allow the care to occur
Yeah.
because you have that added trust and assurance. And
Yeah.
it is not simple, but very few really great, worthwhile problems for humanity solving are simple. And so
True.
I think it's
True.
great. Yeah.
Yeah, for sure. And it's an area that, for anybody who's working with health data, if there's anything that's slowing down the advancement of technology in that space, it's that. It's the fear and the concern around compliance and privacy and security, and that anything you do that's different than what you're already doing
Yeah.
adds risk. So all my data is here. It's on a system on premise in a rack in a room somewhere, and now you want me to move that data to the cloud. Well, that's risk. You're
Yeah.
introducing
Yeah.
risk. And so now we have to make sure we're solving that problem in the right way so that we can reduce the perception of that risk by showing, like, guess what? Our data centers are millions of times more secure than any rack in somebody's building somewhere.
Yeah.
Our systems for ensuring the safety and security of that data are intense. Like, it is a gauntlet to get to the point where we can have a service that is high trust certified, compliant with HIPAA guidelines and all stuff.
Yeah.
It's just a massive investment on our part, and to solve that for customers is huge, because for customers it's a massive investment on their part. So there's a huge cost associated with dealing with that, and to the extent that they can turn to us and say, Microsoft is solving a significant part of that problem for me, maybe not the entire problem, but a significant part, then that's great.
Yeah. Yeah. Makes sense. Well, as we're talking about data now, I think it makes sense for us to start talking a little bit more about data interoperability and
Yeah.
some of the things that we're doing as a company, and that we're doing in partnership with other standards bodies and people in the healthcare industry. So, tell me a little bit more about FHIR, which for those of you out there, FHIR, pronounced
Yes.
fire. As I was learning a little bit about it, I heard it a couple of years ago in various circles, but took this time in this stream to kind of learn about that. But yeah, Doug, tell me a little bit more about FHIR and data interoperability, and what are some of the challenges there that we're trying to solve?
Yeah, this is the way you can gauge how well somebody knows healthcare. If they say FHIR or if they say FHIR.
Yeah.
So FHIR is sort of the newest standard for clinical health data, and specifically for data interoperability. So FHIR stands for Fast Healthcare Interoperability Resources, which is another way of saying there's a data model and a set of APIs to exchange that data, defined by a specification. So FHIR itself is just a specification, and then it's up to people like Microsoft and others to implement that specification. So in a lot of ways, I have to make the analogy to USB. USB is a specification, and then everybody implements that specification. And if we implement it according to the specification, then it works. Everything's interoperable. So FHIR is designed to support the exchange of clinical information. So think about, when we say clinical information, we mean the information that's predominantly what's in your medical electronic health record. So what that doctor is looking at on their computer. And so it's kind of an entity model where you have things like patients and providers and encounters and observations and diagnoses and things like that. And it's a relatively new standard in the world of healthcare. It's been around for getting close to 10 years now. It's on its fourth version. The first version that was really truly starting to be adopted at scale. So the earlier versions were sort of, think of them a little bit as prototypes. They were used, but not very broadly. And so FHIR evolves from previous healthcare standards that were designed around the digitization of healthcare. So previous standards like HL7B2 were designed around how do you take something that was once paper and make it digital, but didn't do a good job of solving the sort of transportability problem of how do we share that data and how do we make it more universally available. So FHIR is meant to solve that. And FHIR, just if you really go look at it, if you're a technologist in any space, you'd be like, oh yes, it makes total sense, because it's just REST APIs and JSON documents describe entities. You're like, this is great. And it solves a tremendous problem. And so the idea there being that all your data is in these health records, but you can pull that data out of your health records in FHIR format and consume them in other applications. So a great example of this is if you have an iPhone and you use the health app, you can connect the health app to a healthcare provider, and you can see all of your, say, oh, your last visit, and here was your blood pressure, and this was your other stuff. And if you scroll all the way to the bottom and look, there's a link that'll say fire resources. And you can see the actual JSON documents that the provider sent to your phone to populate that information. And so, a number of years ago, about 4 or 5 years ago, we were watching the sort of evolution of fire and said, this, I think, we were sort of willing to kind of make a little bit of a bet and say, we think fire is going to become the de facto way that data is exchanged in healthcare. And interestingly enough, if you think about it, not just from a data exchange standpoint, but you think of it from a machine learning and artificial intelligence standpoint, one of the biggest early problems you have in any AI workload is data wrangling and getting all the data I need and getting all that data into a standardized format or a common format. So then I can do something with it. And we're like, hey, fire could actually solve this problem. Not only does it make the data interoperable, so I can go get data from multiple systems, it's already standardized. It's already abiding by the specification. So what if we, Microsoft, were to build a cloud service that natively understood fire and brought it into the cloud and made it accessible to things like Azure ML Studio or Synapse or Dynamics or Power Platform, and then enabled people working with healthcare data to use all of these tools to do really interesting things. And so we started by building our fire service, which came out a couple of years ago. And we got lots of great traction. We actually released it as an open source project first, and we got lots of response from people like, this is great, fire's coming, we need to do something with it, but we don't want to run it. Can you guys run it for us? And so we said, yeah, we can build it as an Azure service. That's totally cool. And so we built that, and we've gotten lots of traction. There's lots of things that have happened along the way to drive customers, in the healthcare space to use fire. And they turned to us and like, hey, you've solved this problem. Great. We're going to come and use Azure to solve our fire problems. And then just recently, we kind of updated this by releasing what's called the Azure Health Data Services. And all that is simply an expansion of our thinking, where we started with clinical data in the fire format. Some of the early feedback we got was, love it. I want to bring my data to your cloud. Fire is great for that, but I have other data too. I have all this imaging data from my PAC system, all my MRIs, my CT scans, all this. Can you give me a place to do that? And customers were giving us questions that they wanted to be able to ask of their data that required the intersection of both the clinical data and the imaging data. And so the Azure Health Data Services basically brings in a couple of new things. We have the Fire API for clinical data. We added a DICOM API. DICOM is the standard for imaging data and has been the standard for imaging data for the last 30 years, 20 years, something like that, since the mid-90s. And then we added a MedTech service, which is essentially a connected devices service. So think of a device that you might wear, a biometric device that you might wear if you're on an outpatient program where your doctor wants to be able to see your biometrics periodically, but you don't want to have to go in and go have a visit once a week to get your vitals taken, as a simple example. And so those are some of the new services. We have device data, clinical data, imaging data, and then we have coming, there's one of our sister teams has been building something called Text Analytics for Health as part of Azure Cognitive Services, which allows you to take a clinical note, just free text clinical note, pipe it in, and it does all the classification of the text and gives you structured data back out. And then we're transforming that into Fire so that can go into the Fire store as well. So essentially, we're kind of bringing all the data in and standardizing on Fire for anything that's textual, and then DICOM for anything that's imaging, and then connecting that to all these other systems within Microsoft to do other work with.
Yeah, makes sense. A little more sophisticated than that vanilla envelope that you
a little bit.
The other hospital. But it's interesting. I think Doug, when you and I worked briefly together, I was working as a web platform evangelist briefly in my career here at Microsoft. And so the fact that these are using web standards like JSON, XML, and things like that, to me, it's still data, right? It's data, obviously, that is secure. And there's all that stuff that you were talking about that is required to really make this solution work well. But at the core of this is interoperability, the ability for a developer who's building from one healthcare provider, and it can work with another healthcare provider. And so that data can securely and efficiently move over across the hospitals and things like that,
Yeah, and it's very approachable. Like you said, it's web standards. It's very approachable from a developer's perspective. It's very easy to understand, and just solves a tremendous number of problems.
Yeah, yeah, very cool. Well, so if you're a developer or data scientist or someone who wants to kind of just try out a healthcare tech, in this API and things like that, how do you get started?
Ooh, that's a good one. It kind of depends. So if you're if the question is, hey, I'm experienced and I'm working on some stuff, maybe I work at a consulting company and we have a healthcare client, how do I learn this? Um, there's a tremendous number of resources available. Like for me personally, I'm a kinetic learner. I learn by doing, right? And so for me, it's like, hey, I'm going to go into Azure. I'm going to spin up one of these services and I'm going to start to poke around at it and see what I can do. And so we've got some great tutorials and things like that in our documentation that you can go try out and say, okay, I'm going to connect this service. I'm going to add this data. I'm going to do these things. There's a great tool for generating synthetic healthcare data called Cynthia. That we use internally for a lot of our stuff to generate synthetic data, so you can start to play around with some of these things. So as you say, okay, I want to one of our I think we still have it as a tutorial, but basically I'm going to generate some Cynthia data. I'm going to pull it into the Azure API for Fire. I'm going to have a web app so I can sort of fake up an experience where I'm looking at patient data so I can see what that looks like. But then I'm going to pull that data into Power BI and I'm going to create some dashboards so I can see some cool and different things. It's kind of an end to end. Like I want to have all the way from data coming from somewhere, being available and used by applications, and then all the way out to a visualization environment. Super powerful. So there's a lot of stuff there. There's just a tremendous amount of resources on the internet around Fire because it is a global standard and it is something that is becoming mandated in the United States for healthcare companies to use, and it's becoming relevant in many other countries around the world. It's a global standard. It's not a US standard. And so there's lots and lots of resources for Fire out there to learn Fire. And DICOM, like I mentioned earlier, it's been around for a long time. So lots of people know DICOM. And now it's just a matter of getting your hands on our service and trying it out and using it.
Cool. Well, you answered one of our audience questions as I started to look at the chat window here, which is whether Fire is a global standard or not. So it sounds like that is the case. And while we're talking about this, for all of you out there, I've got a link here on the center of the screen. But if you really want to try out and explore the Azure Health Data Services, that middle link there, aka.ms/Azure Health Data 5.2 is the quick link we have there. Lots of good resources. I spent some time over the weekend on this, Doug, just checking this out, and it's pretty complete. I mean, I think it's pretty ready to be used by customers and just to be experimented and such, right?
Yeah, and just on a couple notes, I'm going to back up just to address the question around Fire's global standard. So Fire was something that evolved out of the HL7 organization, or Health Level 7. And they're an organization that's been largely responsible for defining healthcare standards for clinical data. So the previous standards of HL7v2 and CDA, these are all global standards for health data that were used by electronic health record systems. So HL7 kind of, they were wanting to help solve the challenge. Like, again, I make this analogy to USB. Like you have USB and you kind of learn what's wrong with it. Like every time I try to plug it in, it's upside down. I got to turn it over. So what if we fixed that plug and made it just universally fit? And then you come up with kind of the definition of a new standard. And so in USB, we now have USB-C, and I never have a problem plugging it in. It just works. And Fire is kind of that. So they said, we need to solve this problem. And so it was actually initiated by a small group of people globally. There was folks leading it out of Australia and out of Europe and out of the US. And then as they started to flush it out, then you got lots of involvement from large companies, Epic, Cerner, big healthcare providers and payers. And then eventually big tech companies like Microsoft and Google got involved to help push it forward. And so over the last 7 or 8 years, it's really grown, but it has always been a global standard. And so our customers are everywhere in the world. Our service is deployed in, I think, 26 regions globally, and we have customers in all of those regions. So yeah, if you know Fire, it's not just a US thing.
Yeah, very cool. Well, before I get to some more audience questions, I wanted to ask you one more question kind of around the product side and the services that people can have. So what's the difference between, the Azure Health Data Services and the Microsoft Cloud for Healthcare? Because sometimes
that's
I think,
great.
they're actually two different products, as I understand, or two different, really altitudes of how you solve it. But kind of put Microsoft Cloud for Healthcare in context of all of this.
Yeah, it's a great question because I think it can be a little bit confusing for people. And part of the confusion is the Microsoft Cloud for Healthcare, think of it as a conceptual thing. So the Microsoft Cloud for Healthcare, much like if you start to look around, we have a Microsoft Cloud for retail and a Microsoft Cloud for financial services. So the idea is that we are shaping these industry clouds by taking the collection of products that we have and tailoring them to a specific industry. So the Microsoft Cloud for Healthcare is really a conceptual thing. It says if we were to take M365 and D365, Power Platform, Azure, and tailor these things for healthcare, we will collectively refer to that as the Microsoft Cloud for Healthcare. And what's confusing for people is you can go buy the Microsoft Cloud for Healthcare, which is really just buying entitlements to all of these different products so you can use them in this way. And so for a great example of this is we've taken Dynamics and we've built a bunch of scenarios in Dynamics to tailor to a set of healthcare challenges. So we have things like a virtual visits solution template, and we have a patient engagement solution template. But that's the visual part of it is the Dynamics interface. But the totality of it is it's the pulling together of Azure and M365 and D365 together. So that's the Microsoft Cloud for Healthcare as a component. And then where my team sits in that, we build the Azure services. So think of Azure and Dynamics and Power Platform and Teams as ingredients into the Microsoft Cloud for Healthcare. But you can use those ingredients for other things too.
Yeah.
So if, for instance, you said, well, I don't need a virtual visit solution template. That's not what the problem I'm trying to solve. But I do need healthcare data because I want to do some machine learning with that. Then I can say, well, I don't need that solution template you have, but I'm still going to use the Microsoft Cloud for Healthcare in the sense I'm going to use the Azure Health Data Services, and I'm going to use Synapse Analytics.
Yeah.
And
yeah.
You're doing something a little bit different with the ingredients than what we provided.
Yeah, the important part there as a platform is you pick what you want to use, right, and you don't have to use the stuff you don't want to.
Exactly.
Well.
It's a little bit like the difference between getting HelloFresh and going to a restaurant and getting a meal. Like it's the same. The same ingredients are going in there. In one case, we're going to just give you the ingredients and you have to make something, and we might even tell you how to make it. Like, hey, use these services, plug them together and do this thing. And in the other case, it's just going to be made for you and you get to consume it and use it.
Yeah. Yeah, I like that metaphor because you're getting to sort of the managed aspect of Microsoft Cloud for Healthcare.
Exactly.
Very cool.
I don't know if you remember the old models. When we first introduced cloud, there's all these like pizza as a service to try to get people to understand what infrastructure as a service versus platform as a service versus software as a service were. It's like, well, in one, you have to provide, infrastructure as a service, you have to provide the oven and the dough and the utensils and all the other stuff, and all the way up to software as a service. Like you just go to a pizza place and they give it to you and they clean up afterwards.
Yeah.
And then all the things in between. It's the same story applies here in terms of how do you want to use these ingredients and what do you want to do with them?
Yeah, cool. All right, well, let's take a couple audience questions. Thank you all for your lively chat in the window there. It was great to see engagement and sharing your voice about healthcare, because like I say, these things are not simple and such as well. But one of the questions, and I'm paraphrasing here, is, today's healthcare tends to feel very, very reactive. And so how can healthcare technology specifically address some of the more preventative or proactive things?
Oh, it's a great question because it speaks back. It goes, rewind the conversation a little bit to your opening question about personalized medicine or personalized care. And this is really kind of touching on the same thing, which is today I go to a doctor because I have a symptom and then they treat that symptom. This is the reactive aspect of healthcare.
Yeah.
But technology is getting to the point where we really can know a lot about a person. And so a number of years ago, we had started this joint collaboration agreement that has now gone public with sort of a collaboration with Adaptive Biotech.
Mm-hmm.
And what's really fascinating with them is they will take a sample of your blood and they'll use our machine learning capabilities to analyze that blood sample, and they'll they'll basically look at all the T cells in your body to see what they're doing and discover the antigens that are being produced in your body to see what's happening. And what they can learn from that is the antigens are being developed as a way of your body reacting to something that's there that you may not even be aware of. And so, by doing this, you can kind of look at your body and say, here is what my body is doing that I don't even know. I'm fighting something I don't even know I'm fighting. That may not even be an issue for me for 20 years, but it's there. It's in my body. Similar to how you might analyze DNA to see you can do these DNA studies to see if you have a higher level of susceptibility to something. So these are all ways that you can start to be more proactive. In some cases, maybe predictive, but proactive in healthcare. And this is really the holy grail. Where we all want to get to a point where, for us, it's a bit of a stepwise approach of, hey, we're going to help solve some of these data problems. We're going to help make these things more available. We're going to help make data more usable. And eventually we're going to get to a point where all of this data can be used proactively to personalize your care so that instead of treating a symptom, you're treating a person and all of the things that are relevant with that person. And how, like the treatment that the doctor does for me and the treatment they do for my wife should be very different because we're different physiology.
Yeah.
We have not just because I'm male and she's female, but we have just different things in our DNA and in our history. And so that's where we're trying to get to for sure.
Yeah. Yeah. To some degree, and I recognize there are limits to some of these types of technologies, but you've even looked at the proactivity of a consumer wearable, a watch or a ring or a different monitoring device, even more of the more medical grade ones, the Internet of Medical Things and things like that as well. To some degree, I'm a believer that type of data substrate, if you're comfortable sharing that with your care provider, that's useful contextual information. I think it has to be taken with one of many different measures that somebody looks at when making a healthcare decision, of course. And totally, you want a professional to help make that diagnosis. But that can be very useful, especially from a proactivity or preventative perspective, because, you know your health best, most likely,
Right. Well, I mentioned earlier the collaboration we had with Hutch around the oncology patients. And that was essentially what we did is we put a biometric device on their arm. It was just a strap-on device, and it would sample 100 different data points and send them into our service. And then you can have that real-time biometric data and the clinical record, the historical data side by side, or even really integrated. And so a care provider could look at this and say, okay, I can see historically, I can see the medications they were given, and I can see right now what's happening in their body, and I can intervene. So if I see, it seems their heart rate is going up, or their temperature is going up or down, or mobility is changing, whatever it is of these 100 data points, and then they can intervene. And this is actually the idea behind this is what would prevent the readmission rate is, if one of the major factors that an oncology patient comes back in the hospital is because they get sick from their medications, then if you can intercept that, you can say, I see that their vitals are changing, or I see that their mobility is changing, or even that they're just what we call a PRO, patient reported outcome. They're reporting that they feel nauseous or something like that. Now I can intervene and I can say, hey, cut your medication in half. Keep taking it, but take half the dosage. And then that changes their reaction, and now they're not being readmitted into the hospital. So it's still reactive in that sense, but it's much more real time, and it's something you can't do, if you require an office visit. Yeah,
makes sense. Well, great. Well, I think we're towards the end of our stream time here. So Stephanie asks a really great question. How does one get experience in this area? So this really gets to the skilling, and this is actually, Doug, one of our themes on the This Just In show is for people who are considering new careers in the data sciences and developers and things like that, development and so on. And so, what do you recommend for people pursuing a career in healthcare technology?
Well, first off, I think it's great. And I'll kind of go back to the fact that this is all based on web standards, and that's what makes this so accessible and so easy. And I'll share my own experience. I came into this just about 4 years ago, into this team to build these healthcare products with no background in healthcare. I came from previously working in IoT on our automotive platform, and before that working in our developer division, building Visual Studio and the .NET framework and things like that. And so I came into this knowing cloud technology and knowing web technology, but not knowing healthcare. So for me, the journey has been learning the healthcare space, but applying the technology to it. And so if you're coming into this, learning the basic technologies, REST APIs, cloud infrastructure, cloud scale, things like that, all the sort of web and cloud 101 stuff is critical. And then understanding how healthcare works is the next piece of that. And like I said, especially around Fire and DICOM, there's so many resources available. You can go take courses in Fire certification, so you can learn how the Fire standard works. There's courses in DICOM certification if you're more into medical imaging and digital pathology and things like that. But I would say, start with the web and cloud 101 stuff, and then start looking at these particular standards, because there's a wealth of information about them. And in fact, there's a conference coming up, maybe in a month, I think. It's end of May or early June. I can't remember the dates off the top of my head, but it's called Fire Dev Days. And so if you just go to devdays.com, this is a third-party conference. It's not put on by Microsoft, but we're actively involved. But this is the Fire community event of the year. So all the godfathers of Fire, if you will, the people who wrote the original specification, come and talk about how they're evolving the specification, what they're doing. Implementers like Microsoft come and talk about how we're implementing the specification and what we're doing. Consumers and advocates who are using data and using the specification come and talk about what they're doing. So it's a great event. If you're wanting to learn about this space, it's a great place to go and just get into sessions and meet people and start learning.
Yeah, no, it sounds fantastic. So yeah, and I think I also heard, just web development. If you're an absolute beginner or a beginner, those full stack web dev skills, I think, are key here.
Yep.
We didn't talk about it a little bit today. You alluded to a little bit about AI and ML. Obviously, that's a huge component of the health and life sciences as well. So if you're a data scientist or aspiring one out there, there are data sets. As Doug mentioned, you can go and check out and learn, and what interesting data to work with too.
Yeah, there's all kinds of good data sets out there to work with. And we've just released into open source, and this will become part of our product in the near future. Essentially a Fire to Synapse connector. So you can essentially export your Fire data out of our service in Parquet format and consume it in Synapse and start to build some of your data science work there. And we're exporting Parquet, so you can kind of do all kinds of different things with it. So there's great opportunity for people who are into data science and want to look at this space. There's lots, like you were saying, there's lots of good data sets out there. If you want to go grab some publicly available data sets, you can also generate some synthetic ones if you just want to try some things out. But the ability to export the data into the Power Platform for visualization, or export it into Synapse to do different machine learning and analytical workloads, all kinds of great opportunity.
Yeah, for sure. Cool. Well, I think, Doug, to wrap it up, thank you so much for joining me today. I learned a lot about healthcare and tech. I'm going to have to check out some of those sample data sets too. I haven't done that myself, not with healthcare data. So seems like a good next step for you technologists and devs and data scientists out there. So thank you, Doug, for being here today. I really appreciate it.
Thank you, Justin. It was great. Anytime.
Yeah, awesome. And so for all of you out there in the Reactor community, I've got some links up here on the slide. If you're more focused on as an entrepreneur or business or decision maker, we've got some great resources. I took the Get Started with Microsoft Cloud for Healthcare. Also tried out the AI Business School for Healthcare. Some interesting kind of more conceptual content that you can learn about some of the decision-making processes that other organizations might have using healthcare tech. And obviously, as we've talked about today, if you're a dev, web dev, data scientist, or somebody who's just a technologist that really wants to get in with the data and interoperability, do check out the Azure Health Data Services and all the stuff there as well. But otherwise, if you're new to the show here, I have all of our episodes on our GitHub repo, aka.ms/thisJustin. I've got one more show next week, which we're going to talk about NFT and cryptocurrency before we get ready for Microsoft Build as well. So again, thank you, everyone. Join me next week for This Just In. And if you're on Learn TV, I'm going to leave this slide up to the top of the hour where the next show begins as well. So again, thank you, Doug, and have a great day, everyone.
Thank you, Justin.